interest in dental public health really developed because when Keith worked in the hospital clinic, I would go up to the villages in Kilimanjaro and find the kids in the schools who needed care and bring them down for dental care. And while I was there in the schools, I found massive dental fluorosis. And so I sent some water samples back to Indiana University, where Dr. Stuckey is, the world-renowned fluoride researcher, and Dr. Mueller. And there was no fluoride in the water supply. I mean, none. So like, how can this happen? And so, to make a long story short, that ended up being years later, being my dissertation research. Turns out, again, to make a long story short, they were using a food additive that was harvested from the soda lakes in a volcanic area of the Rift Valley that had massive amounts of fluoride in it. So I was on this expedition for a number of years to try to figure out this public health mystery. And it was obviously something that the people didn't welcome. They didn't want brown teeth. And some of the kids finally admitted they were taking a stone and rubbing their teeth to try to remove, and really they were removing a lot of enamel. So anyhow, my attempt at just identifying kids who needed care turned into an epidemiological study to test the possibility that altitude may have an effect on their fluorosis level, because they were living on Kilimanjaro, and then it ended up identifying a whole system of cooking and serving food to very young children that had a tremendous effect, including skeletal fluorosis, crippling skeletal fluorosis. So that was kind of my venture into public health. That's what made me love public health, is the whole mystery and the opportunity to really get into another culture, learn another language, and do something that had the potential of being meaningful.